We are coming to you this hour with a major development on a potential COVID vaccine. Pfizer, the first drug maker to file for FDA emergency use authorization. The company saying it's ready to ship the vaccine within hours of its approval. That is great news, but Dr. Anthony Fauci says it does not mean we can go back to our normal lives just yet.
We are in a very serious situation, but we can do something about it. Point number one. Point number two is that help is on the way. So we should make them be, one, an incentive to have us double down even more with public health measures until we get the full component of the health that's on its way.
And with good reason, here's a staggering number. 193,000 new coronavirus cases were confirmed in the U.S. just yesterday. That is a new record. States are doing what they can to reduce their numbers. Illinois, Kentucky, Minnesota, Colorado, Montana, and parts of California all introducing new restrictions. We have reporters across the country with the latest on COVID safety measures and the numbers. NBC News Now correspondent Maura Barrett is in Philadelphia, where a new round of safer at-home restrictions kicked in at 5 o'clock tonight. NBC News national security and Pentagon correspondent Courtney Cubie has details on Air Force nurses being deployed to North Dakota hospitals. And NBC News business and tech correspondent Jolyn Kent is in Los Angeles, where there is a new order coming. Joe, we start with you. A new limited stay-at-home order going into effect in California tomorrow through most of December. What are the new rules and restrictions? What should we know here?
Yeah, Allison, this covers about 94% of the state. Those of us in purple counties, if you will, purple zones. The partial curfew will go into effect 10 p.m. to 5 a.m. and it applies to all non-essential businesses and organizations. So we're talking about gyms and bars and restaurants and things like that. And so essentially what you're going to see is some of the restaurants and bars that have been trying to make some sort of comeback on especially outdoor stuff are going to see a scaling back of their business. This also comes as Governor Newsom reaffirms no indoor dining, no major gatherings for religious services and things like that. And so the idea is to keep the positivity rate below 8% in these counties that are facing a surge. Although California is faring slightly better than much of the rest of the country, especially the Midwest, there is this ongoing concern, especially with Thanksgiving less than a week away, Allison, that those numbers will go up.
Yeah. Joe, how are small businesses handling this announcement? I mean, after months of running well below full capacity and ahead of what is typically a strong holiday season for them.
Yeah, the holidays mean so much, especially to bars and restaurants, right? Restaurants not only do well with those coming to celebrate, but also catering and supplying businesses that are now long work from home. I interviewed the owner of Tuning Fork. It's a restaurant in the Studio City neighborhood of Los Angeles. He says he's lost 80 to 90% of his business. It's been so frustrating for him. Here's what he had to say to me this morning.
If you take the fact that we lost the Lakers playoffs and championship, the Dodgers playoffs championship, we're losing Thanksgiving, we're losing all the holiday parties and events in December that office people would have. I just can't even forecast anything. It's just a complete loss, truthfully. I certainly just hope and pray every day that our elected officials remember that they work for us and we put them there, and that's the bottom line.
He says that he really does support, obviously, all of the health and safety regulations that the state has put forth. So he wants everyone, his employees included, to fully comply with those regulations. But it's just been so hard on their bottom line. And he's basically limited his hours from being open 12 hours a day, which was pre-pandemic, to just 4 hours, from 4:30 to 8:30 every night, mostly pickup. And here's the double whammy, Allison. He just got approval to do dining al fresco per the county of Los Angeles, to have that outdoor dining, to get that equipment, and then this curfew just coming this weekend. So he sees it as super painful. It's just a huge bummer, and his story representative of thousands of other small businesses out there.
Oh, Joe, and it was heartbreaking to just hear, you realize the pandemic, but you didn't think, oh, my goodness, all the people that would have gone out to watch, to celebrate the Lakers, all of the other events that have been going on, that people have just been watching from home, and the economic impact that's had. Wow.
Just so brutal, and they're trying to make it through, but it's a really uphill battle. It's huge, and it's going to be tough.
Really tough. Joe, thanks so much for reporting on this today. Really appreciate it. Now over to Courtney Cubie. She has the latest on the Air Force nurses.
Allison, there have been two recent developments in the military related to COVID. The first one is U.S. Army North announced late Thursday evening that they were sending approximately 60 Air Force nurses to North Dakota. As you well know, North Dakota has been hit very hard by the coronavirus. Just in the last several weeks, their numbers of positives have skyrocketed, and the mortality rate there has really shot up. Well, that led the governor of North Dakota to request help from FEMA. That was answered, that was approved, and U.S. Army North is the one who answered it, sending these Air Force nurses in there. They're expected to deploy this weekend and begin working in 6 different hospitals in 4 different cities throughout the state as early next week. The second headline relates to the new acting Secretary of Defense, Chris Miller. So late last week, he met with the Lithuanian defense minister. We found out late Thursday night that, in fact, the Lithuanian defense minister had tested positive for coronavirus. Now, we know from a series of photos and from information about from media who covered the event, a very small pool of media who were allowed to cover the event, that they had masks on at some points during their meeting, but there were many points where they took their masks off. We have a photo of them shaking hands. They signed an agreement sitting very close to one another. So there were stretches throughout this meeting where they were not following CDC guidelines for both wearing masks and social distancing. In addition to meeting with the acting Secretary of Defense, the Lithuanian defense minister also met with the Army Secretary, Secretary of the Air Force, and the Secretary of the Navy. None of these individuals, though, have decided to quarantine. Defense officials are saying that's because the majority of the time they were meeting, they followed the CDC guidelines of wearing masks and of social distancing. But again, I have to stress, we do know that that was not the case throughout the entire course of these meetings. We also learned that, in fact, a senior advisor to acting Secretary Miller has since tested positive for coronavirus. That's retired Brigadier General Anthony Tata. He's a senior advisor to Miller, and we also have at least one photo showing that he met with the Lithuanian defense minister last week as well. Again, the only person at this point among that entire group who we know to be isolating because he has tested positive is retired General Tony Tata. The others are all still working, and defense officials are saying that's because they believe that they were not in close contact, despite the fact that we now know that acting Secretary Miller was in contact with 2 people who have tested positive for coronavirus. Allison?
Let's go to Maura Barrett. She's in Philadelphia, where those safer-at-home restrictions are now in effect.
Allison, when you look at Philadelphia's weekly average of increase of cases, it makes sense why these restrictions are going into place. This week's weekly average was higher than any other number we've seen since March, and so the city is working to curb the spread of the coronavirus yet again by closing down any dining in indoor restaurants, working out at gyms or indoor fitness exercise classes, museums, theaters, bowling alleys, anywhere where community spread is possible is also shutting down. They're also scaling back the limits of people that are allowed in churches or even shopping in retail stores. So a lot of adjustments here in Philadelphia happening starting at 5 p.m. tonight. So that just went into effect. But what we see as people are creative, as they've been throughout the entire pandemic. This entire street in Old City, Philadelphia is shut down for the weekend to allow for restaurants to have outdoor dining. But again, in this new restriction wave, people can only have 4 people at a table when dining outside and only with members of their household. So restaurant owners I've been speaking to are really concerned about what this is going to be doing to their bottom line. We're right in the historic area of Philadelphia, so people who were going to go see the Liberty Bell or go to Independence Hall, those are closed now, so they can't come to the restaurants here or spend their time in this historic district the way that they want to. So these restaurants that had to lay off their workers back in March are looking at the prospect of having to do that again. They say that they're on their last legs if they don't see any aid coming from Congress. So they're asking those in D.C., those lawmakers, to take a look and come back after after recess to pass another round of PPP loans, or better yet, they say the Restaurant Act, which would really help especially these small mom and pop shops. Now, it's not just restaurants. These owners of small boutique fitness areas and gyms are really frustrated because they say there's no scientific data tracked back to community spread at gyms. A petition actually going around here in this city looking to make gyms an essential business because they say it's best for customers' mental health, especially in this crazy time of a pandemic. So a lot going on here in Philadelphia statewide. We're also seeing record-breaking amounts of new cases every day, but they're working to get ahead of it and hopefully curb the spread. Right now in Philadelphia, these restrictions are set to last about 6 weeks, but again, people are really worried that it could go on even longer. Allison?
If you have made it this far without getting COVID or losing a loved one, you might be feeling a little bit invincible. You might think it's safe to socialize outside your bubble. Well, think again. MSNBC host Rachel Maddow has a warning.
My relationship with Susan is the only thing at the end of the day that I would kill or die for without hesitation. And Susan has been sick with COVID these past couple of weeks. And at one point, we really thought that there was a possibility that it might kill her. I'm guessing that you might be willing to risk yourself, right? Especially after all these months and all this time. It's so frustrating, right? I would have done anything. I would have moved mountains for it to have been me who was sick these past couple of weeks instead of Susan. I still would give anything for that. But this thing does not give you that choice. It won't necessarily be you. It'll be the person you most care about in the world. And how can you bear that?
Dr. Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security, joins me now. Dr. Adalja, we just heard Rachel talking about how terrifying it was to watch her partner, Susan, struggle with this virus. I think all of us, even her colleagues, saw that and were just stunned for what they went through and heartbroken for them. If we as a country ignore the CDC guidelines, if we go ahead with big Thanksgiving celebrations and traveling and going outside our bubble and having contact with other people, what kind of December are we going to be looking at in this country?
It's going to be a very dark December, and we're already seeing it in November with hospitals getting more patients that they can handle, hospitals constantly worrying about capacity, and clearly just seeing the number of deaths go up. That's likely the trajectory we'll face if people stop behaving as if we're not in a pandemic. They need to realize that this virus is out there, and it's with all of our social interactions, and that there are common sense things you can do to decrease the risk of transmission. And we need to start doing them. That's the only way we move forward in this pandemic.
What is your best advice right now for viewers who are going to sit down this weekend and try to make a call about whether they should host or attend a dinner? How do they make that decision? What do you tell them?
First of all, it's going to boil down to risk tolerance, because you know that along with all of your guests sitting around the table, the virus is going to be pulling up a chair as well. This is not something that you're going to be able to avoid. So you got to know that it's going to be there. And then can you make it safer? Can you decrease the size? Can you decrease the number of households? Can you pod different households so that they're all sitting together? Can you get people to wear face coverings and face shields when they're not eating? Can you do this outside? All of that's going to make it a little bit safer. But we know that we're going to see some transmission occur after Thanksgiving. The Canadian Thanksgiving about a month ago had increasing transmission after that. The same is going to be true from our Thanksgiving. Hopefully it's something that people can keep to a minimum by taking common sense precautions. But a lot of us are worried that we will see in about 2 weeks even more cases in the United States, and more hospitals are worried about their capacity.
Dr. Fauci explained what type of testing we really need in this country. Here he is on MSNBC earlier.
We should be flooding the system with tests to determine the penetrance of the asymptomatic spread. We don't have that availability of tests. We should have tests that are point of care, sensitive, specific. You can do at home. You can get the results yourself so that you can know when you wake up in the morning, when you want to go to work, whether or not you are infected, or whether the people you might want to invite over your home for a holiday are infected. We don't have that. We should have that. I hope we do get that.
Dr. Dalja, what is our testing situation right now, and how far off would you say we are from that ideal or that better situation that Dr. Fauci described there?
Our testing situation is not in a good place. If you look at Dodger Stadium and you see lines of people to get tests. This is now 11 months into the pandemic, and we're having the same discussion that I had with you back in February and March when this pandemic virus first kind of hit the United States. We cannot get rapid turnaround tests. We cannot get people to know their status in any kind of timely manner, and that totally compromises contact tracing because they're getting a test that's maybe 5 or 6 days old, and that's not useful to them. So we do need to go to where Dr. Fauci has said. And I've been working hard trying to popularize this idea of home tests, cheap home tests that can tell us whether we're contagious, that we brush our teeth, take that test, and then know what we can do that day. That's where we have to go. We still in the United States in November can't do what Taiwan and South Korea could do in March. And I think that's a deplorable state of conditions. If we went to war like this, we would lose that war, and we are losing this war, and we do need to get testing turned around. It's one of the most important ways we can move forward.
Dr. Fauci also talked about vaccines. He keeps saying that help is on the way, but we can't let up until a vaccine is rolled out. If Pfizer gets this emergency use approval from the FDA, how long do you think it'll reasonably be until we get back to some sort of normal in this country?
Likely well into 2021. You have to remember the vaccine isn't going to be available all at once. It's going to be kind of doled out in terms of priority groups. So healthcare workers like myself, as well as high-risk individuals, are probably going to be in the first priority group. And then after time, the general public will start to have access. So maybe around the summer of 2021 is when the general public with average risk are going to get it. But it's going to take some time for that uptake to be enough that we can get back to completely going back to what it was like in 2019, at least some semblance of that. So there will still be recommendations, maybe not mandates, but recommendations to think about masks, to think about mass gatherings, to think about all of the social distancing. But it will slowly kind of fade away, and we will eventually get out of this mess. But it's going to take some time. And we have to remember that these vaccines are lights at the end of a tunnel, but we're still in a tunnel.
Dr. Dalja, thank you for all of your expertise. And just for the smart advice here, we've got a long way to go and we still need to be really careful. Thank you.
Thank you for having me.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.